What if your customers are trying to find your business online, but instead of finding you, they find your competitors? Now, more than ever, it's time to make sure you have the right SEO to make your business stand out online. Welcome to Go Mind Your Business with Terry Bork, presented by Extreme Marketing Concepts, putting your business in front of the hungry herd of buyers who are looking for you right now. Extreme Marketing Concepts, helping you drive more traffic, dominate the market, and crush your competition. And now, here's Terry.
Hello, everybody. Welcome to another edition of Go Mind Your Business. My name is Terry Borg with Extreme Marketing Concepts, and it's so great to have you all here again today. I've got a really awesome treat for you today. Today we have Zunzun Care that we're going to get to learn more about. So I'd like to welcome Mayumi Moreira and Dr. William Palmer. Welcome to our show.
Thanks for having us on.
Thank you for inviting us.
Oh, awesome. I'm so glad to have you here. Let me share with you all a little bit about Zunzun Care. And I have to tell you, they are an amazing center. They're located off of North Dale Mabry in the Baybridge Center Plaza. Zunzun Therapeutic Care is a haven for gifted massage therapists who specialize in alleviating pain from auto accidents and medical conditions and stress relief. And their philosophy is that true physical rehabilitation can only be achieved when the body and mind are aligned. So they treat the body holistically in a unique center for wellness, and their healing techniques combine contemporary sensibilities with century-old techniques to regenerate, revitalize, and restore a healthy body, and to help you live a happier life. Their goal is to help you reach your healthiest potential. And I got to tell you, I had a massage there the other day, and it was the best hour of my life. I never pamper myself, and Mayumi, I was like, didn't even want to get up out of that bed. I was really loving it. So, an amazing therapist, licensed massage therapist she is. So welcome again to our program. So I think, Mayumi, my first question is for you, and it's how you came up with Zunzun. Where did that name come from?
Well, Zunzun means hummingbird.
Okay.
That's how we call hummingbird in Cuba, where I'm from. So I just wanted to incorporate something that will reflect my origin, from Cuba. So that's why I came up with the Zunzun Therapeutic Care. Because also the hummingbird, it has incredible characteristic, for being such a small bird. And that's the same view that we see on the body. The body is amazing, so we can achieve great things like the Zunzun hummingbird does. So that's why we created that name, Zunzun Therapeutic Care, where we can accomplish great things holistically for the body. So.
Okay, awesome. And their office, by the way, like I said, they're over in Carrollwood, and you can find them at 13909 North Dale Mabry in Tampa, 33618. And if you have any questions at all, they're happy to answer them. You can find them, dial them up at 813-443-5726. So, Mayumi, what made you become a licensed massage therapist?
Well, as I told you before, I'm from Cuba, and I was in the Cuban water polo team for almost 8 years. And I always had therapy, massage therapy, and everything that was related with that as my physical rehabilitation. So when I got here to the United States, I wanted to do that, to help people on that way, the way I was helped while I was in the Cuban team. So that's why I decided to become a licensed massage therapy. My main goal was, a way, like a natural way to help people achieve their goal, relaxation or rehabilitation. So that's what moved me to become a massage therapist.
Awesome. Okay. And next you have Dr. Palmer. Dr. Palmer, how'd you get into chiropractic?
It's kind of a funny story, because I'd always wanted to be a doctor. All through school, everybody said, man, you'd make a great doctor. You'd make a great doctor. So I really started looking into it, and I was originally going to go into obstetrics. However, when I was in high school, I got involved in martial arts. I also got involved in bodybuilding, and I was exposed to chiropractic at that time period. What impressed me about it was the fact that it was not meant as a reparative type of art. It was meant to be preventative and to enhance performance. And what you found is some of the world's top athletes, and in particular, the story of Arnold Schwarzenegger introduced me to one of his friends who was a chiropractor. And I was really fascinated, and the more I studied, the more I was interested.
That's awesome. And I know that chiropractic, it can help so many things, but it can prevent so many things. And I know, if you're not properly adjusted, you can get a cold, but when you're properly adjusted, you tend to fight off sickness better, I think.
Better, yes.
So it's always a good thing. So you always want to stay adjusted. I think that's a great thing. So, there's a lot of horror stories about chiropractors. Is there one big myth that you would like to dispel for us today?
The biggest myth would be that chiropractors cause stroke. And you have these, you should never let a chiropractor touch your neck. And what was interesting is there was a number of years ago, there was a court case involving this very thing. And what was horrible about it was that you had a girl, it was in Canada. She had gone to her chiropractor because she had headaches, had not seen him for quite some time. A month later, she has a stroke. And her son reports, she saw a chiropractor, so it's reported as a chiropractic stroke. 10 years later, this thing goes to court. There's horrible records, no documentation that this actually did cause it, and it kind of brought the issue to a head. Well, they did a study after this point. What they found is that the odds of you having a stroke from a chiropractor are about 1 in 4 million, which is, when you figure the odds of getting hit by lightning are 1 in 11,000, not too shabby to start with.
Right.
And when you figure just how often that would happen, it's really ridiculously astronomical. So the odds of you having a stroke under a chiropractor's office are the same as you having a stroke anywhere else on the planet. Mm-hmm. So it's just not true. Just not true at all.
Okay, great. And, so is chiropractic care safe for almost anybody?
Almost anybody. There are some conditions that you want to screen out. For example, if somebody's had a surgery in a specific spot, I wouldn't adjust that spot. But when you figure there's so many other places in the body, I adjust people that have had surgeries all the time. But I don't work on the place where the surgery occurred. I work on the other areas to support that area.
Mm-hmm. Okay, great. So, are there a lot of people say that when they go in for a chiropractic adjustment, they hear a crunching. Is that bones popping? Is that a normal sound? What is that sound that people hear?
Let me pause. There's over 200 systems of chiropractic out there. Some of them have, it depends on the technique.
Sure.
And just like any other job, you want to use the right tool for the right job. And you find that you can use instruments, you can use tables that moves, or you can simply use your hands. Some of them you can hear noises, some of them you don't. The cracking, on the other, is just like opening a Coke bottle. You open a Coke and that air releases. Mm-hmm. Well, if you've ever seen a water hammer, it leaves that nice little sound whenever you smack it. Mm-hmm. Well, whenever you've got something in a vacuum and you release the pressure, it makes that pop sound. So it's just like, there you go. That's all there is to it. Mm-hmm. It's not the bones moving at all. It's the actual the release on the capsule.
The release of the air.
Exactly.
That could be between.
That's the noise you hear.
Okay, great. And it's perfectly safe for that to happen, and people shouldn't be alarmed if they hear that.
No, the old myth is that, that causes arthritis when you pop your knuckles. Absolutely not true at all. Okay,
great. Perfect. Great to know. Thank you for sharing that with us. So don't be alarmed. It's just your body saying thank you. Right?
Well, it also releases endorphins. So a lot of times whenever you see people do that release, you've got 20 minutes of extra morphine in your body.
Oh, sweet.
Which is why everybody likes it so much.
Everybody likes it. I got that. Okay, so we all need more chiropractic care. So we can all feel better for 20 extra minutes.
Yes.
That's awesome. Mayumi, what are some of the benefits of regular massage treatments?
Well, nowadays people are getting more into the benefits of massage, that even big companies are starting to use to bring licensed massage therapy to their work area. So and they have noticed that especially for works that require exercise or lifting, a lot of the worker, they have reduced the problem with the back problems or release stress in the work area. And that's why nowadays more people are getting into massage because some of the benefits are reduce your blood pressure. It also help you reduce stress and increase the the release of chemicals such as serotonin will help you the regulation of your mood, your mood and your digestive system and your appetite. So that's some of the benefits of massage, other than, it's the best form for relaxation.
Now, and I know that you do different types of massage. Like me, I really wanted just to relax. I don't know what it's like to be still for 5 minutes, let alone for the hour that I had on your table.
Yeah.
So, and I know that you were able to create an amazing atmosphere and actually get me to be still, which was so brilliant and so appreciated. What other types of massage can you do with somebody who just doesn't want to just be still and just feel good?
Well, for massage, if you want to get like a relaxation feel, you almost every time get that, because we create a mood on the room that help you just not think about anything, just be relaxed and just want to go to sleep. That's the main focus for the massage. But there are also other techniques, especially for people that they don't like to be touched too much, or maybe they don't want to take off their clothes. You can get the same results if you do like a Thai massage or just a compression massage. So you'll always get that feeling of relaxation. So you can do it. You will always stay still and get to that point.
Okay, awesome, great. What do you think makes Zunzun special compared to other locations in the Carrollwood area that offer some of the same services that y'all do?
Well, our main focus on Zunzun is the patient. We always want them to feel welcome, and we like to treat them like family. So that's our main focus on Zunzun, where they can come in and just feel relaxed, like family, comfortable. And we always combine not just massage, but we always take into consideration what they will really need. It's not because we offer massage, we will offer just massage, but if they need something else, we always try to find out what is really necessary for the patient. So it's our focus is to have a customized treatment for that individual.
From my end, what I try to do is look at a patient from 6 different angles. Because when you look at a person, you hear stories about, well, gee, we've got this cancer patient down the hall, or we've got this patient with heart disease. What about the person? So I want to look at the person from 6 distinctly different points of view. Now, we deviate a little bit from standard chiropractic or standard massage in that I want to pay attention to all those other factors. I want to look at you structurally, which is what a chiropractor does or a massage therapist does. Physical therapists do this. But you also want to pay attention to your nutrition. What type of nutrition? I can, and one of the complaints about chiropractic is always, well, gee, once you go, you got to keep going. Well, part of that is if you're eating crap, then yeah, you're going to have to keep going because you're not going to be doing well. If you're eating good food, having good exercise, in a good mental state, I don't need to see you nearly as often. So we want to pay attention to your emotional state. We want to pay attention to your toxicity. We find 8 out of 10 people have toxins in their bodies that are not allowing them to be well. Electromagnetics affect some people, okay, and allergies affect some people. From those 6 different angles, if we pay attention, then we can get people to a better state than they would have been any other way. And that's something that does differentiate us because, if somebody comes in and they've got allergies, I'll give you a good example. I had a patient a number of years ago who she did everything right. Everything was perfect. I could not have imagined a better lifestyle for this patient. But we ran an allergy test. She was allergic to ginger. She was using ginger in all of her juicing. And ginger is wonderful stuff, but not for her. We took ginger out of her diet. Everything got better. And had we not paid attention to the allergy, then her adjustments wouldn't hold, her massage would not have helped. She had problems sleeping, and everything went away with one small thing that we paid attention to.
That's outstanding. Great. So it's important to know your patients.
Exactly.
Okay, great. Dr. Palmer, what is subluxation and what causes it?
Okay, subluxation is an old chiropractic term, and unfortunately, it differs from the medical term. Now, subluxation medically means something that is out of place but not dislocated. And that is true except in chiropractic we define it as something a little bit smaller, but it has physical effects, has physiological effects, and has biological effects. And what you find is that when you misalign the spine ever so slightly, it changes nerve flow. This is the basis of chiropractic care in and of itself. Imagine for a minute I took $1 out of your paycheck. Would you notice?
Maybe not $1, but a little bit.
It's $1. Come on. Unless you're going to Wendy's, what's the big deal, right?
All right.
But over 20 years, I've robbed you blind.
Oh, yes, absolutely.
What if I double what I take every time you get a raise?
Yeah, I would
Eventually, it's
notice
like
that.
taxes, right?
Yeah.
The thing here is that when a subluxation is a little bit of a pressure created on a nerve. Now, I only need the pressure of a dime, 10 millimeters of mercury, pressing on a nerve that alters your nerve function. Now, I'm going to take a leap of logic here. I'm going to bet you that you're better off without that pressure. Any problem with the logic?
Nope.
Imagine that little bit of pressure is that $1 coming out of your check. And over time, I double what I take every time you move.
Mm-hmm.
That is the basis of chiropractic.
Okay.
If you have that problem, I simply go in there, remove that problem, and let your body work the way God intended it to.
Okay.
Very simple concept, probably
Yeah.
the most pure one on the planet.
Uh-huh.
That's what subluxation is.
Uh-huh.
Now, the effects of that can be huge, okay? Because most people come in and say, gee, doc, this hurts. I can't feel my fingers or my feet hurt, and that's fine. But when you remember that 9/10 of your nervous system feels nothing, then what happens before you felt it?
Mm-hmm.
Okay, you got nerves going to your heart, to your liver, your stomach. You start robbing those paychecks. Your heart forgets how to heart, your liver forgets how to liver, your stomach forgets how to stomach. We end up with other problems down the road.
Yeah.
Now, this was referred to early on as dis-ease.
Right.
Now, if you have dis-ease, it opens up the door later on for a disease.
Mm-hmm.
So we do a liver biopsy 10 years down the road, we've got bacteria. Oh, damn those bacteria. It's kind of like saying flies cause garbage.
Mm-hmm.
It doesn't work that way. If you've got garbage, you're going to attract some flies.
Mm-hmm.
Same thing here. So if I can remove that subluxation before it's a problem, I've prevented something from happening worse down the road.
Okay, well, brilliant. That's a great way to look at things. So shift it up a little bit and get a much clearer understanding. Thank you. How about kids? Can they be adjusted? Is there a safe age on children to bring them in?
I will tell you that with children, generally children bounce relatively well, but when they don't, it's really horrible.
Mm-hmm.
And there's a real soft spot in my line for kids. And I should tell you a story with this because
Please.
I met an 18-year-old girl a number of years ago that had all kinds of health problems. And when we inquired as to her story, what we found out is when she was 4 years old, she was involved in a car accident with her mother. Her mother was transported to the hospital. Her dad came, picked her up, and she said she hurt, but she looked okay, and they carried her home. Here she is at 18 years old. I do an x-ray of her. This child's back was broken, and no one ever caught it.
Right.
So I want to look a little extra special at kids. But that being said, there's an entire branch of chiropractic that looks at pediatrics. I will tell you that my oldest patient was 104. My youngest was 4 minutes old.
Mm-hmm.
Now, you don't always need to adjust the children, but you always check. And what you find is when they're born, they pull them out by what?
With their head.
With their head, which often causes that first little twisting in their neck. And if I can correct it before they start to grow,
Mm-hmm.
then they grow straight and strong as they're supposed to.
Mm-hmm.
And it's amazing how many children come in, and I see them once, twice, and they're fine.
Mm-hmm. Now, can the adjustment help them with colic?
It can.
Uh-huh.
There's many causes for colic, but that would be
Mhm.
one of the things that does seem to improve.
Okay, great. Is there an age where, chiropractic shouldn't be used, or where it's dangerous?
Age, no. Conditions, yes.
Conditions. Okay.
Like I said, my oldest patient was 104, and
100, yeah.
I don't think we're going to pass that by much.
No, probably not. And if they do, that's awesome. They can go see Dr. Palmer. He can treat you, no problem. Okay, great. So, Mimi, what other services besides massage therapy and chiropractor do you offer at Zunzun?
Well, we also offer facials. If you just want to look better, we also have body treatments, body wraps. We have spinal decompression, nutritional consult, as well weight loss programs. And also, if you've been in an auto accident, we also offer rehabilitation for that. So that's what we want it to be, like a complete wellness center where you could find everything you need to prevent any problems in the future, and also to be beautiful and feel beautiful.
Sure. Okay, great. You know, you talk about the automobile accidents. I know, Dr. Palmer, you're in the office there. We have the 14-day law now down here in Florida.
Yeah.
14 days so you can present a claim. Are you equipped to handle a patient who's had an accident within those first 14 days? Can they come
Absolutely.
in there and take a look at, and be seen by you?
Absolutely.
Okay, great. And perfect. I know you offer something called Va-Va-Voom body treatment. What is a Va-Va-Voom? It's so exciting. I don't know.
Well, that's something that we created. We came out with a name, and we actually offer three of our most popular, well-known treatments, which is ultrasonic cavitation, radio frequency, and vacuum therapy. We offer those three services, and we created the Bababon. Mm-hmm. So that one is a body contouring program that we offer, and what the ultrasonic cavitation does is help you melt the fat cells in the body. So it's specific for certain area that you would like to get rid of extra fat, like on your stomach, your arms, your legs, on your back. And we combine the cavitation with the radio frequency, which help you tight the skin because it's increased the production of collagen on the skin. And that one you can also use it on the face. And the vacuum therapy, it also help you move all the extra fat in the body, and also mold the body wherever you want to mold it. So that's our Bababon, the three treatments: the ultrasonic cavitation, vacuum therapy, and radio frequency.
Okay, awesome. Dr. Palmer, I'm curious, if I crack my own back or my neck, am I giving myself an adjustment?
No. Not at all. Okay. It's funny because the thing is, the cracking in itself, like I said, is not really a problem. Mm-hmm. The problem exists that whenever you start trying to do it yourself in the spine, you often move the areas that are easy to move without moving the stuff that needs to move. Oh. So what you eventually do is create an unstable environment for certain areas in the spine. Mm-hmm. It is always better to have somebody else do it, I will tell you. Even if they're an idiot, it's better than you doing it yourself. Okay. The problem, as I mentioned before, though, is that when you release it, it does release endorphins. So it's like, oh, crunch, morphine. Okay. so you're kind of giving yourself a little high every time you do this, which is why people keep doing it. And it feels good for a little while, usually about 20 minutes. And then you're right back to the same spot. Okay, if you truly want to fix it, you go to a professional who knows what they're doing, and they specifically move only the segments that need to move.
Got it. Okay, makes a lot of sense now. So what are some of the benefits that someone can get from visiting the chiropractor?
Well, like I said, when we're looking at auto accidents or sports injury, you're looking at getting people from an injured state back to a normal state, or at least as normal as possible. There are things that are still beyond anybody's skill to fix. The benefit there, of course, is that what you find is that whenever you're injured, it sets up a pattern of things that alter motion, not just in the spot of injury, but across the entire body. Also, you'll find that some things, if you treat them early, they don't develop a bigger problem. And now, my problem with the 14-day rule you were mentioning before is that there are some things that don't show up immediately. And if you can get on it before it's a problem, then the problem doesn't develop. The TMJ is probably the biggest thing, the jaw.
Right.
You won't see that problem for 3 to 6 months following an injury, and it's really nasty. But when you're looking at other benefits, for example, I was a sports team doctor for a number of years, and my football players, they'd go out and play. One of the British Medical Journal studies on this specifically noted that athletes under chiropractic care perform 10 to 13% better than athletes who are not. Now, if you want to add that up, that's 30 points on a batting average. That's the difference between loser and Hall of Fame. Mm-hmm. So I would tell you that if you're looking for strict benefit, either for injury, you're looking at preventing further injury and limiting the injury that you have. But for sports, you're looking at some serious performance enhancement. Now, I've worked with football players and martial artists for a number of years. But what you'll find right now is some of the top names in sports are using chiropractors for this benefit. Tiger Woods has his own chiropractor. Lance Armstrong carried his with him. Mm-hmm. Jerry Rice speaks very, very highly of his chiropractor out there. You go to Kentucky Derby, every one of those horses has one. Mm-hmm. It's really something else when you realize that every major football team has got a team doctor. As a matter of fact, I trained under the guy that does the Kansas City Chiefs.
Yeah. I think the one thing for me that was really interesting is during the Olympics that we just had last summer, you were seeing the chiropractors with all the athletes.
Sure.
You know, they were all the swimmers. You know, was where I most noticed them. The swimmers and the runners is where I think they were spanning, and you get to see the adjustments being performed. And I'd not noticed that before, but I thought it was really neat to see that at the Olympics. So you don't have to be hurt to use a chiropractor. You can just maintain top physical performance.
The idea is to not get hurt.
Okay.
To get one perform better and then be in a position where, because of your motion, you're not creating injury.
Mm-hmm. I got that.
I will tell you that I looking at patients with scoliosis in particular, scoliosis is one of those things that the base treatment has not changed since the 1950s.
Mm-hmm.
It's really scary.
Mm-hmm.
I've seen a 55-year-old patient who was never treated who could barely move. I've also seen a 78-year-old who was treated when she was little and saw a chiropractor religiously every month for her whole life. She still plays competitive tennis.
Wow.
That's the difference in having care versus not.
Okay, great.
Now, she still has scoliosis, but she can move.
Wow. Okay, well, that's really important, being able to move and not hurt.
78, I think
At
so.
78, yeah. That's awesome. We're speaking with Zunzun Care. We have Dr. William Palmer and Mayumi Morita with us today. If you have more questions, you can visit their website. They've got a very comprehensive website at www.zunzuncare.com, and you ZUNZUN care.com. We're going to take a quick break and hear from our sponsor, and when we come back, we're going to learn the difference between medical massage therapy and regular massage therapy. Hang on just a moment. And we are back. Thanks so much again for joining us here on Go Mind Your Business. Go Mind Your Business. We're putting your business in front of the hungry herd of buyers who are looking for you right now. If you have any questions on how to get that done, give us a call at 813-863-1452. Again, we are here with Zunzun Care, 813-443-5726. They're here to help you with any of your massage or chiropractic needs, and they have a whole holistic office with so many amazing things on the inside. You really have to go check them out. My guests today, Mayumi Morita and Dr. William Palmer. Before we skip for break, Mayumi, I wanted to share with our guests the difference between medical massage therapy and a regular massage therapy. Can you go into that a little bit for us?
Well, for the licensed massage therapy with experience, it shouldn't be a difference. Once a lot of people, they think, oh, I just want a relaxation massage, and they just want like a light touch, but every touch is therapeutic or medical. So when I do a massage, I always focus on your problems, and I will get the same results for a relaxation, but also giving you relief of your problem. So it shouldn't be a difference between the therapeutic massage or medical massage and relaxation, because you can have both results in one treatment.
Okay. Oh, brilliant. Okay. And are there other things that patients come to you for besides massage therapy or chiropractic care?
Yes.
Yeah.
On our office, they come for the body treatments, for the facials, or if they want just to lose weight, or just to have like a body wrap or feel better. Yeah.
Okay, and what? I know that you have the like a gym area in your office. Can you talk a little bit to us about the workout room? and you have a Power Vibe in there. A little bit about that, which is an amazing piece of equipment.
Yes, the Power Vibe, that one is to do, you can get like a full body workout just on 12 minutes or 15 minutes with the Vibe. That one, we use it a lot of time when we have patients that are getting body treatments. That way we can get everything moving on the body through vibration. But also we use it for therapy when we want to like build muscle, to increase the strength on the muscles, and the patient, because they are injured, they cannot do lifting weights or do any other type of exercise. So it's really good for both, just for regular workout, for therapy, rehabilitation, and also for the body treatments as well.
Okay, great. And is there from a medical side, can anybody be on the Power Vibe? I know that Madonna loves to use hers. She incorporates it in with her gym routine. So pretty much good for anybody to get
I
a
would
vibe?
say yes, because it's not anything invasive. It's just vibration. So you are standing in the plate on different positions, depends of the muscle that you would like to work, and it's just vibration, and you can increase or decrease the intensity, depends of what you would like to achieve. So I will say yes.
Okay, great. And I know the one thing that I really loved about it was I felt so awesome when I got off of that. I guess it released all those endorphins that Dr. Palmer was sharing. I just wanted to smile all the rest of the day.
Yes.
It was great. So, okay, perfect. The weight loss program that you were talking about, can you share that from us, and how is it different from some of the other weight loss programs that are available today?
Well, the weight loss program we're using is a homeopathic-based program. Now, what we discovered a number of years ago is that, number one, it's impossible to lose weight if you don't have the right nutrition involved. But what we also know about the body is there's an awful lot of electrical things going on. Homeopathics address the electrical side of what's going on there. So if I want things to be promoted, I want to kind of sync that frequency. If I want things to be released, I want to sync that one also. So one of the best ways to get rid of toxins, which often cause people to retain weight, is by using homeopathics to get rid of those things. And by using that, it kind of moves that in the right direction. Now, our program involves several different facets. The food you eat, it is a calorie-restricted diet. But if we're just going to restrict calories, you only get so many results. I mean, you're going to end up with loose skin. You're going to end up with bad energy. This is designed to put that together in such a way that it does not do those things. It releases it safely, effectively, and it keeps it off. Okay,
great. How does the diet affect how a person feels?
Oh, grossly. I mentioned before about food allergies. And I can give probably the best example I can have. This is the first time I was ever exposed to allergy. I watched a video of a child who was a normal child, coloring in front of his mom. It was great. What had happened is that when he would go to school, this child turned into a demon. Well, what they did is they took a sample of the air at the school, and they simply opened a jar with the air in it in the room, and this child transformed in front of your eyes on video. He started screaming, tearing the paper, biting his mother, kicking, screaming. It was horrendous, going from one mood to the other by simply changing the air. And what it amounted to is they were doing construction on the other end of the school, and that air, whatever was in it, affected that child that adversely. So that your diet can be horrible. And what you find oftentimes is if you find something in a person's diet, it can completely change their mood. Now, a number of years ago, a doctor came out with a book called Eat Right for Your Type, talking about blood typing and how your diet should work. I don't think he's got the answer. I do, however, think he's onto something. And what you find is that if you put people on a diet that is closer to the food that they need, they do a whole lot better. Now, we do allergy testing. One of my favorite tests is from a company called ALCAT. And what they do is they basically separate foods out to a green zone, foods you should eat, from the other zones. And you find that if you stick to the green zone, then you find that your mood changes, your diet changes, and they've actually found that simply by eating only the foods on that list, not even calorie restricting, you can lose a huge amount of weight. On the test they did, they took grossly overweight patients, simply changed the food to the foods on that list for each patient. They all lost 100 pounds on average.
Wow.
Within 6 months without changing anything else.
Anything else, just by staying in the green.
Exactly.
Wow.
By not eating things that were not good for them.
Mm-hmm. Is that a test that you recommend people to get done with them?
It is one of the tests that I recommend for virtually every patient.
It's just a simple allergy test.
It's a simple blood draw.
Blood draw, yeah. Okay, wow. And that's probably brilliant. Okay. Emotions. Let's talk about those for a minute. Do emotions play a big part in your health?
Huge.
Huge, okay.
Huge. Here's the thing. When I tell you I look at 6 distinct things, what you find is that not all people need to have all 6 things addressed. You do need to pay attention, however. Now, I had the privilege of working with a doctor for a while whose average patient were rape victims, incest victims, post-traumatic stress, cancer survivors. I had one girl that was ritually abused by satanic cult most of her childhood. These are people who, if you do not address the psyche, you cannot address their physical. They will always be sick. They will always be hurt. Now, did we do chiropractic care on them? Yes. Did we pay attention to the diet? Yes. But you also use things like color and sound and other type therapies that affect their mind in such a way that it affects their body as well.
Okay, great. All right. Well, and the chiropractic, now, did that help them, with the chiropractic care, did it help their mood at all? Or it was really just maybe a therapist and
well, the simplest answer to that, honestly, is a person who's in pain doesn't act polite, generally speaking.
Okay.
And it's funny because they say, well, gee, depression can cause pain. Well, yeah, but pain can also cause depression.
Sure.
So this can go both directions.
Okay. Thank you. Wow, that's really neat to know that. Mayumi, Bob Hope lived to be over 100 years old, and massage was part of his daily regime. Do you believe that massage can extend the longevity of your life?
Well, we haven't had actually studies for that specifically, but if you look at all the benefits of massage, like help you feel better, less stress, less pain, you will actually have, if you don't have nowadays, some of the main causes of this is heart attacks, and a lot of that is caused by stress or high blood pressure. So when you get regular massage and you are addressing all those problems, you could actually have like a longer life. But there is not actually like a study specific for that.
Most of the studies are short term. And if I might add to that, another big name you might pay attention to is Jack LaLanne.
Jack LaLanne, yes.
Jack just died about a year and a half ago, and he was like 109 or something?
Yeah, something like that. Yeah.
Really, really old. What most people don't know is Jack actually was a chiropractor.
Yes, he was. He was a chiropractor.
But he said, gee, you need to have a good diet. You need to have good exercise. But it was all about the circulation. When you really look at massage, there's an old Chinese saying that there's only one disease, ingestion, one cure, circulation. This is true for economics. It's true for the body as well. And whenever you start adding circulation, you get things moving the way that they should. Things do not stagnate, and everything is better when it moves.
Wow, that's brilliant. Yeah, good point. Thank you for sharing that. Do you recommend though for massage if you're healthy and you're not stressed out and you just want to get a massage? Is massage therapy still needed for somebody?
Well, everybody needs a me time,
time.
relaxation time. So
girl time, boy time, it's all good.
Yes, and even if you are healthy, you are healthy because you're doing exercise, and you need those muscles to relax as well. So I would say everybody needs a massage from time to time.
Yeah.
So
I don't disagree. Yes. I thought it was, like I said, I was just like, yeah, baby, let's go again.
Yeah.
It was great for me. And like I said, definitely want to go check them out. And they're located right here in Carrollwood. You can find them at 13909 North Dale Mabry. Very convenient, easy to get in and out of, right off of Handy Road in North Dale Mabry there. Mayumi, what kind of education does a massage therapist need?
Well, Most of the school that offer massage therapy is about a year, and we do extensive classes on anatomy and physiology. We learn about the muscles, disease, and all that, because it's important as a massage therapy to be familiar with all that. So it's specific for, to learn everything about the body. So.
Okay, great. And Dr. Palmer, how about from a chiropractic side? What kind of education does a chiropractor need?
Quite a bit, actually.
Okay. Well, I'm sure.
I remember thinking I'd never get out of school.
Oh.
Here's the thing. Virtually all the professional classes have the same prerequisite education. You usually look at education in 3 different stages. Undergraduate studies, graduate studies, and postgraduate studies. The undergraduate studies for chiropractors, medical doctors, veterinary doctors, and pharmacists is virtually identical in order to get into the graduate school. So we have the same prerequisite education as anyone else. Once you get into the graduate schools, the chiropractic school is actually quite extensive. As a matter of fact, if I remember correctly, there's several hundred hours more of education time to become a chiropractor than a medical doctor. Mm-hmm. What is different, however, is that the medical doctors have residencies, we do not. And once we graduate, they dump us on our heads, and we fend for ourselves. So that's a little different in that regard. There are plenty of postgraduate studies, and there are definitely postgraduate degree programs out there. But most chiropractors, once they graduate school, they're out. But the other difference, of course, is we go straight through. We don't take summers off. Mm-hmm. So when we say it's a year of study, it's a full year of study, not 2 semesters. Okay. And so it actually ends up being quite a bit more.
Right. Okay. Perfect. Thank you for elaborating on that. I appreciate it. When a new patient comes in to see you, what kind of a test can they expect to receive from you to evaluate their condition?
It depends on what a patient is coming for.
Okay.
A patient comes in for an accident. The thing with an accident is, generally speaking, you're going to walk out with an X-ray. Mm-hmm. If you, on the other hand, if you got something a little bit more extensive, we'll go with an MRI, what have you. A patient coming for general wellness, however, it really depends on what they're looking for. Because if a patient comes in and says, "Gee, doc, I'm doing everything right, but something's still not there," then I want to go a little bit more deep. What I like to do, if I had my way with every patient, I would have them do an X-ray mm-hmm. of their full spine, preferably in motion.
In motion?
Motion X-rays are much more diagnostic, and I can see so much more. Because, when do you hurt? Mm-hmm. Most people don't hurt when they sit still. They hurt when something moves. Uh-huh. So a motion X-ray makes all the difference in the world, and is not that much more expensive. Mm-hmm. And interestingly enough, it's actually less radiation. Mm-hmm. The second thing I would have them do is a comprehensive metabolic panel, the blood test. Every doctor in the world does the same blood test. The difference is that what I'm looking for isn't what's wrong. I'm looking for what's not right. Mm-hmm. And I can say that because some of the blood values, when you look at them, you'll see the normal test is high, low. Yeah, doesn't tell you a whole lot. What if things are just ever so slightly out of normal? Mm-hmm. They're not wrong, but they're not right. Mm-hmm. So you start seeing things different. Probably the best example of this would be blood glucose. Okay, I saw a patient the other day. Their blood was 113 for glucose. Mm-hmm. Now, most of us would say, "Gee, you should be on metformin by now." But no, the test said it was normal. Mm-hmm. I will tell you that anything over 85 is not. Mm-hmm. Okay, that blood should be much tighter, 75 to 85. Mm-hmm. And what you find is that I can make small dietary changes before they ever need the medications,
right?
If I know what that is. But I get that from that complete metabolic panel. And the cool thing is, if they've got a medical doctor who's already done that test, all I have to do is pull that test and look at it. The other 2 tests that I strongly recommend are a vitamin D test mm-hmm. and an arachidonic omega-3 ratio.
Okay.
Now, if the patient has told me that they have issues with allergies, at that point I'll start looking at food allergies.
Okay, perfect. If we can go back to your digital X-rays for just a quick moment, are you able to take those X-rays in-house, or do you need your patients to go outside and get those X-rays?
The answer is kind of both.
Okay.
Usually I send them to a center, but the fortunate thing about right here is the inventor of digital motion X-rays right in Palm Harbor.
Okay.
And what's nice is they have a mobile unit. Uh-huh. And a lot of other communities have mobile units also. So if I've got a patient who needs one, I can call them up. They can send their mobile unit out, and I can get it done right there.
Okay, great. Why are vitamin D tests so important? You were just touching on that a moment ago.
Well, interesting thing about vitamin D is there's not a day that goes by that you don't find a new study on it. Mm-hmm. I'll give you a baseline example. what we find is that when we start doing tests, we find that 60% of the people out there are severely deficient in vitamin D.
Yeah.
Now, the problem with this is that you say, okay, gee, so I don't have enough vitamin. Well, I'll give you a good example. A number of years ago, they started taking a bunch of students. They put them on 800 IUs a day of vitamin D. What they found is over 2 years, it eliminated 80% of cold and flu.
Mm-hmm.
There's not a flu shot on the planet that claimed that.
Right.
Not at all. But when you start finding the other things that are going on, vitamin D affects pain, it affects diabetes, it affects Alzheimer's, affects heart disease, affects the gastric motility, so how your stomach works, it affects migraine headaches. It's amazing how many root things you find on a low vitamin D level.
Okay.
And what's interesting is when you start looking at the optimal levels versus what we're looking at, I had a patient who a while back went to her doctor, got a vitamin D test, and they go, oh, you're fine. I'm going to tell you the optimal level for a Caucasian is 50.
Mm-hmm.
This patient's was less than 20.
Okay.
And all kinds of other problems. When you start looking up through the literature, what's out there, virtually every problem she's got is listed under that. Furthermore, I find a dozen other patients have the same kind of problems and the same vitamin D levels, so low,
Okay.
so horribly low.
So for our listeners who are listening now, hearing what you're saying, should they just start taking a vitamin D tablet? Should they wait and be seen by a doctor to
I would do a
discuss
test.
that with him?
I would do a test.
First? Yeah.
Well, vitamin D is a fat-soluble vitamin, okay?
Okay.
What that means is that can build up in your body, and it can reach a toxicity level.
Okay.
Now, the safety of taking a basic vitamin D, not a problem. But you definitely don't want to megadose it unless you know what you're doing.
Okay.
And you want to set it based on that test.
Okay.
Now, I will tell you that I can put some relatively high levels in your body, but I always want to monitor it with a blood test.
Mm-hmm.
And it's not hard. The test is a finger prick.
Mm-hmm.
Put it on a little piece of paper and send it off. It's about $70.
Okay.
Really cheap.
Great. Okay, perfect. And allergies, are those tested the same way?
Allergies are generally done with a blood draw.
A blood draw. Okay, perfect. What's the overall experience that both of you would like your patients to achieve when they come in to see you at Zunzun Care?
Well, I will say that they feel comfortable, that they are getting a specific treatment for what they need. We like to listen to them and take care of all the needs that they have.
Mm-hmm.
So we want them to come back. So that's why we want them to feel comfortable at home and they can receive exactly what they need
Mm-hmm.
at our facility.
Perfect. Dr. Palmer?
I generally like to get patients that no one else has had a chance to fix.
Uh-huh.
And a lot of times patients will come in and say, Doc, I've tried everything. And they give me a list. And it usually takes me about an hour to go through everything they've already tried.
Mm-hmm.
And it's funny because you start hearing certain things ring out. That if you really listen, you can hear these things. And generally speaking, part of the reason why I do the tests that I do is what do you hear? Mm-hmm. My blood sugar's off. My vitamin D level's low. I'm not taking EPA, the fish oils. And you can see all the problems with it right along the way, which is why I do that other test. Or I've got food allergies.
Mm-hmm.
I've got stresses, so our emotions are back in there. Or I'm sensitive to the electromagnetics around me, and you see this over and over and over.
Mm-hmm.
Now, physically speaking, a lot of these patients have never had an x-ray ever. And there's some simple things, so simple. The curve of the neck, drastically important. If no one's ever addressed it, then we know where they've got problems. What we know now that we did not know 20 years ago is if I got 20 degrees of curve in your neck, you have no pain. You may not necessarily have pain with less than that, but if I know that if you're in pain and I can get 20 degrees, you have no more.
Mm-hmm.
And nobody pays attention.
Mm-hmm.
Yeah.
Okay? We know that 1 in 4 patients have one leg shorter than the other.
Mm-hmm.
Sometimes it's significant, sometimes it's not. But I can put a $5 lift in one of your shoes and change everything.
Mm-hmm.
Some patients I can do a little scan of your feet, put a little a custom-made orthotic in your shoe, changes headaches, back pain, and depends on the person what they need. But the thing is, nobody has paid attention,
Mm-hmm.
and that's the real key. We want to pay attention to all those little things that nobody ever did.
Mm-hmm.
And it's not about, come in, get a chiropractic adjustment, get out. Because if that's all you needed, well, then it'd be working for everybody else, wouldn't it?
Right.
Yeah.
And I love chiropractic. It's what I do.
Mm-hmm.
But sometimes there's a little bit more to that picture. I've got a patient who's vitamin D deficient. They're not going to maintain the bones for me to do the adjustment.
Right.
Okay? I got a patient who has taken too much B6. Because I get patients bringing entirely
Right.
grocery bags full of vitamins, and they've got all these neurologic complaints. Well, that's a toxic vitamin.
Right.
Okay, it's a good one. You need it for lots of stuff. But if you're taking too much, you got neuropathy.
Sure.
Understanding the difference here really matters.
Okay. Perfect. Maybe, are you able to work with the insurance companies as well? Do you take a lot of insurance in your office?
For a chiropractor point, yes, we accept most major insurance that are out there, auto accident, auto insurance as well. For massage, not all insurance company cover for that, but we have we have a wellness club.
Sure.
Just in case that you have insurance but they don't cover for massage therapy. We have pretty affordable prices on our wellness club that will help you get the massages that you would like to get.
Yeah, you were sharing with us a little bit with me the other day. Can you share it with our listeners what's included in the wellness package that you have going on right now?
Yes, what we have in the Wellness Club is a membership program. What we offer in there is a $49 a month program that will cover a chiropractor adjustment and a massage. And if you want to get additional treatment for that, you can get it at the same price.
Mm-hmm.
It's help you. If, let's say, it's pretty affordable, $49 a month, that's not too much, but also you're getting the benefit of having a massage every month and also an adjustment, but on the first visit we will include like a consultation with a chiropractor, which we will go over all your symptoms and if we need to do anything extra from that point, we can address all those other problems that you may have.
Okay, perfect. Well, that's a nice package for people to get started with, or just to continue to feel good and keep their blood pressure down and stay stress-free.
Yes.
Stress-free. Okay. And it works. And like I